Welcome to the Windsor-Essex County Health Unit's media briefing for Wednesday, December the 15th. We will open the meeting with some statements from our CEO, Nicole Dupuis, and then we will move into our media questions. So please, Nicole, you can start.
Okay, good morning, everyone. Thank you for joining us. Again, I'm Nicole Dupuis, the Chief Executive Officer of the Windsor-Essex County Health Unit. I'll just start off with a few numbers for everyone. I know that's always one of the first questions. So for today, we're reporting 96 new cases, 28 are close contacts, 17 are community acquired, 3 are outbreak related, and 48 cases are still under investigation. Currently in our area, we are managing 636 active cases and just under 7,000 contacts. We have 483 deaths overall in our communities. We reported 3 deaths yesterday and 1 additional death today of a woman in her 80s from the community. Currently, there are 37 cases hospitalized and 14 individuals in the ICU. And we are managing 31 active outbreaks at this time, many across workplaces, schools, and in community, as well as long-term care and retirement homes. That's it. We'll just take questions.
Okay, thank you, Nicole. We will start with 2 questions in our opening round, and then we'll do one more round of follow-up questions following that. So we will start today with any questions from the Kingsville Observer.
Yes, I'd like to know whether you're able to look at your statistics and break down the rate of vaccination in a municipality like Kingsville.
So we do report vaccination by forward sortation, so the FSA, so the first 3 letters of a postal code. So you should be able to find that information on our local data page for each FSA, and Kingsville would be captured there.
Well, the reason I ask, and this is all anecdotal, there are people in town saying that our rates of vaccination are not only low, they're egregiously low. I wonder if you can verify that.
Well, Nicole, do you want to? I can comment. The vaccination rates are in Windsor-Essex have a lot of opportunity for improvement. The higher the vaccination rate, the lower the burden of disease is to the community. If you're vaccinated, you're less likely to get infected. You're less likely to be hospitalized from COVID, and you're less likely to die from COVID and less likely to transmit COVID. When we look at the data for the last few months, 2/3 of the deaths have been among the unvaccinated, and the unvaccinated are a minority of the overall population. So a small group of people represent the majority of deaths in the health district. And I think Kingsville, like the rest of the city, has opportunities for improvement. I'll ask Nicole to comment specifically on any data elements that may or may not be available. If you could comment on that, Nicole.
So it'd be hard for me to specifically comment on the region of Kingsville, but it looks like, based on our data that's on the website, for those that are fully vaccinated with 2 doses, they're about 80% for the N9. Let's see, it's the N9Y area, which I think does cover a good portion of Kingsville. Certainly for N8H, which I believe is part of that area as well, it's a much lower coverage area, one of the lowest in our region at about 66%. As well, that's for 2 doses. As you know, we are rolling out boosters. We started this week with 50 plus. And certainly as we look at things such as Omicron, which we did report yesterday, our first case of Omicron in Windsor-Essex, we anticipate there probably, it's, potentially been here longer, but certainly that's an important factor to consider as well as it relates to transmissibility. But looking at N9Y, it's about close to 80%, just around 80%, and the Leamington sort of county area is much, much lower.
So it looks like it's above the average rather than below.
Yeah, I don't know if we can make that. I don't know if we can conclude that inference. Look, Kingsville is not an island. I'm not from Windsor-Essex, so I don't know the geography. But Kingsville or any part is not an island, and it's about when from a pure science point of view, it's about the human-to-human interaction. People in one part of Windsor-Essex probably work in another part of Windsor-Essex, shop in another part of Windsor-Essex, and so to me, the real scientific question is, in the aggregate, are we getting sufficient vaccination rates across the health district? And I think the answer is that we have still opportunities for improvement. It's also when we abstract data by FSA, it's where you live. Remember this: many people actually work far from where they live, or they work in an adjacent area. And so when we characterize risk, where you live is not the only factor in determining the effectiveness of vaccine.
I will just also add that the important comparator is where Windsor-Essex sits compared to the province, and Windsor-Essex, every FSA within Windsor-Essex is below the provincial average for vaccination for fully vaccinated individuals. And that's our important sort of marker, is looking at, as a region, how do we increase our vaccination rate? And how we use the FSA data, at least here, is related to planning. So looking at within our different regions within Windsor-Essex, are there areas that we might want to put a little bit more resources in targeting? But overall, as a community, as Dr. Nassaturi said, we do need to improve our vaccination rate for fully vaccinated individuals. Even at 80%, that is lower than where we need to be.
And I'll just ask one more question, and then I'll let everybody ask their questions, and I'll have a follow-up later. The booster shots are now available. Will those statistics be included in your vaccination rates, like 1 dosage, 2 doses, and the rate of people having the booster shot?
Yeah, that's a good question that I can't answer right on the spot, but certainly we'll be talking to our epidemiology team, and we do update our data tables all the time, and certainly third doses is something that you may see us adding.
Thank you.
Yeah, if I could just share data that doesn't involve individuals, but is in the aggregate or something we're more readily able to share. There's always we always have to think of the resources needed to report certain data elements. We try to pick the highest priority on ones. But from my perspective, knowing the percentage of people who are eligible for third doses of vaccine and the ones that have actually received it, I think it's a valuable data element, and we'll do our best to try to provide insights into that data element. If not reported every week, we can try to summarize that at some point in the time in the future.
Okay, thank you.
Thank you. Any questions from Windsor Star?
Yes, good morning. Nicole, you just mentioned that you anticipate Omicron may have been in Windsor-Essex for longer than as indicated by the discovery of this initial case. Can you clarify what you mean by that?
Well, I think we have started testing, so it's discovered by the sequencing, but that is more of a recent development. So yeah, that's all I meant by. Go ahead,
if I
Dr.
could supplement that, we will learn more about the pandemic when the history of the pandemic's written, when it's concluded. We know that we have the first recognized case of Omicron in Windsor-Essex as of yesterday. But is it possible, or is it likely that Omicron was here even before that? There's a reasonable possibility of that. We've been working with that assumption because we know that by the end of the month that Omicron was thought to going to be the dominant variant, and we believe its doubling rate is substantively greater than Delta. So I think that's what, to provide some additional context to why we think that Omicron was likely here before the first reported case. And we are sending some samples off for further assessment, and we'll know more as time progresses.
Well, then it may negate my second question in that is the first recognized case, is that individual relatively isolated, or were they out in the community with a lot of close contacts? But that question being asked, if you anticipate it may have already been here, does it matter to try to have heightened awareness of an Omicron case's activity versus a Delta variant case's activity?
Well, that's a very fair academic question. As far as we're concerned, the Public Health Service, we're happy to we're okay with reporting the variants, but it's really the public health consequences of that. The people who have COVID are appropriately isolated; their close contacts are identified and appropriately self-isolated. The more important thing to know now is that we have to get third doses of vaccine in people over 50 and improve our vaccination rates of all young people for two very important strategic goals. One is we think that there is some component of waning immunity, and the third doses might provide some additional protection for people over 50. And we think that trying to limit the spread of COVID-19 among school children will break the chain of transmission. But your point is a very fair point. Omicron is not likely to be the last variant. You know, we said on Monday that it's only a matter of time that we'll have a recognized case in this health district. There'll probably be other variants, and we have to think from public health policy how we can address that issue. The other thing is the vast majority of the world are not vaccinated, and it behooves us, I think, to try to improve vaccinations through in our health district, but throughout the world, so that we can bring better control of COVID-19. We're not an island in Windsor-Essex or in Ontario, and I think that we have this obligation to try to improve vaccination rates in our community, in our province, and throughout the world with the best resources we have.
Thank you.
Any questions from AM 800?
Nicole or Doctor, I'm not sure if you can share this because obviously, like you mentioned, you're still looking into the case of the new variant. But any idea how it came to Windsor-Essex? Did this individual travel outside the region or interacted with someone that had it? If you know what I mean. I'm not sure if I'm wording it correctly, but do we know how it came to Windsor-Essex?
Yeah, we're not really, you know, and I know this is, we don't mean to be repetitive at the Public Health Service. Items that identify individual people we're reluctant to share unless it serves a compelling public health interest. Without commenting on this specific case, it would not be unusual for people at this point to have travel-related or Omicron variants, but there are likely also to be transmission within from person to person. So I don't think we can provide any additional comment on this particular individual and how they might have become infected or what the mechanism of transmission might be.
Okay, thank you. Doctor, 20 plus months into the pandemic, did you think we would be at this point, I guess, during the pandemic? Did you think we'd be better off? It just seems like, and I know we've been talking about the past couple of weeks, how our numbers are increasing. Seems like obviously across the province and across the world, Windsor-Essex, it's getting worse. Did you think we would be at this point, or did you think it would be a lot better at this point?
Well, I can give you the unnuanced answer. No, I never thought that. Who would have thought we would be 20 months into it? Like, I don't know if I'm talking as a public health official anymore, but as a person, yeah, I don't think any of us thought we'd be here 20 months from now. I think as a practical matter, we always have to understand that there are new diseases. HIV was a new disease. SARS was a new disease. In some parts of the world, TB is there's a resurgence of TB and polio. So we always had communicable and infectious diseases. And when I first understood COVID-19, I don't think we fully understood what the consequences would be and the level of persistence of our public health management up to that point. That being said, despite this being a challenging situation, is we do have tools at our hand and we're not using them as fully as we could. We have a vaccine and we know that the vaccine works. It's not perfect, but it works. And if we were to get vaccination rates to a higher percentage, we'd have better control of COVID-19. We also know the disease is causing significant burden to the community. We're going to get updated data today, but the last time I looked at the data since August, we had about 45 people die of COVID. 2/3 of them are unvaccinated. Many of them were entirely preventable deaths. People that had many years of life to live, who were whose lives were cut short by COVID. And so, if we're able to get vaccination rates higher, we'll be in a better position to control COVID. If people make decisions to reduce human-to-human contact during this holiday season, I think that'll be an effective approach to bringing the number of cases lower and the number of people hospitalized lower. But yeah, the short answer is no. I didn't think. Sorry for that long-winded response, but no, I didn't think we'd be here 20 months later.
Thank you.
Any questions from CTV?
Yes, good morning. Now that a new variant is in Windsor, will further restrictions be needed at large gatherings like sporting events and concerts?
Well, we've every option always remains open to the local public health service. You know, the statute, the Health Protection Promotion Act, contemplated that local measures may be required based on the local circumstances. And as all of us know, Windsor-Essex has suffered disproportionately from COVID-19 when compared to other health districts. I would anticipate that the province may also make additional announcements or additional restrictions, given the fact that we're continuing to have people die of COVID and being hospitalized from COVID. It would not be, the province may ultimately choose to make additional public health measures to try to bring the disease under control, or a bit better under control. And I think we should, you may want to ask our provincial colleagues that question as well.
Thank you. Now, the federal government is advising against non-essential international travel. Do you think this is the right step, or should they go even further?
Well, I think that, you know, I always defer to the federal government for matters related to the border. And so I would redirect the question to them. I think at a local level, minimizing human-to-human interaction, getting vaccinated, are all important measures. Wear a mask indoors. Wear a mask if you can't remain consistently 2 meters away from other people. Wash your hands. Those basic public health measures are what really needs to be done. But matters related to travel and the borders are for the federal authorities, and I urge people to follow the guidance of the federal authorities.
Okay, thank you.
Any questions from CBC?
Yes, thank you. I understand the health unit's concerns around protecting people's personal information, but I do have a question. For many in the community, unfortunately hearing yesterday that someone in their 20s has died with COVID-19, it's obviously very concerning. Can you share at all if they had underlying health conditions that may have contributed, or if they were vaccinated?
You know, the public health service, since always worked with sensitive information. You know, we work with people's having sexually transmitted illnesses or sexually transmitted infections, other communicable diseases, and we do our very best to protect their privacy. If we didn't protect their privacy, I think it'd be harder for us to get information to control communicable diseases. I can share with you in general what we know about the deaths in Windsor-Essex, and that's Windsor-Essex experience. About 45 people have died of COVID since August of this year. 2/3 of those people who died are unvaccinated. Of the unvaccinated group, some were perfectly healthy or would not anticipate they'd die because of respiratory illness. And some of those people who were unvaccinated had other concurrent medical problems. About the other 1/3 of people who died who were vaccinated, they all had some level of medical problems, many of them significant medical problems. And in part, one of the reasons they're dying is because they can't mount an immune response to benefit from the vaccine. So as a general construct, if you had a kidney transplant, you're on immunosuppressive, you're on drugs that suppress immunity. And if you get vaccinated, the vaccine is not going to work for you as well on average as someone who's otherwise well. We know that COVID deaths affect both vaccinated and unvaccinated people. We know that COVID deaths affect people in various age bands, including people in their second, third, fourth, fifth, sixth, seventh, and eighth decade of life. And so the fact that we have reported a death and so on in their second decade of life is consistent with what the burden of COVID is. If I could share with you another way, on average, if you think about 45 deaths and there's 17 weeks and 1/3 of the year, we're having a few deaths every week. If we were to, at least some of those deaths every week can be prevented if people got vaccinated. That's really the issue, that we have it within our power to protect ourselves and protect our families from senseless death. And as we report these death statistics, I would urge those people who are currently not vaccinated to get vaccinated. If there's one group of people that can help the community, it's people who are currently not vaccinated who can get vaccinated, because they're the people that are most vulnerable from COVID-19, and we want them to not suffer the adverse consequences of the disease. Also, when someone presents to the hospital with COVID and they need to be admitted, that means that resources for people with other diseases are not available. And intensive care unit resources are highly valuable resources. So when you get vaccinated, you're helping yourself because you're less likely to get sick and you're less likely to die, but you're also helping other people in your community, because if you do get sick, if you don't get sick, you don't go to the hospital. If you don't go to the hospital, that means those hospital resources are available to other people. We also have a core of hospital staff who are exhausted. Subjectively, they are exhausted. And I think hospitals have articulated how worried they are about maintaining continuing function. So given all of that, I think that's the core message, that COVID-19 can affect people in all age bands. Deaths can happen in people in their second, third, and fourth decade of life, as well as other decades of life. The vaccinated and unvaccinated are vulnerable, but the unvaccinated are particularly vulnerable to the most adverse outcomes of COVID. Again, I'm sorry for being long-winded on this, but I hope that provides some context.
No, I do appreciate that and some of the breakdown there, but I will add, other public health units in this province, and including this one in previous iterations, did disclose that information. And I wonder if you could maybe shed more light onto, why we're choosing not to do that now.
Well, medicine. Oh, go ahead. Go ahead, Nicole.
Go ahead. I can add after. Go ahead.
Medicine is about a whole group of judgments, and we make different judgments based on the facts and circumstances. It also is based on the context. I think from my perspective, the privacy of individual people we serve is paramount, and unless it serves a compelling public health interest, we will do what we can to protect their interests. Also, the families in a smaller health district, especially in smaller areas, things that may not seem identifiable are readily identifiable. And the families of people who died, I think, have the right to privacy and the right to grieve privately. So that is the balancing act. And I know as members of the media, you face these same challenges as well, as what is newsworthy and what is not. And at least from my vantage point, protecting the privacy of people is a really important goal, and it's a judgment that every medical officer of health and public health service has to make. Nicole, perhaps you could supplement my response.
I was going to say that I thought we had addressed the question, and that we wouldn't provide any additional details. Individual privacy is certainly paramount and something that, is important. And again, I think what we're sharing is our crude, I guess, counts of deaths within our community and sort of the overall picture, which is probably from a public health perspective is the more important information.
All right, any questions from Blackburn?
Yes, I wanted to know if any of the new cases today are of the Omicron variant.
I don't have knowledge of the distribution of the variants of the cases today. We may have more information as the day progresses.
Okay. The other question I had was, as you know, Omicron has become a big issue in Kingston, and they're now down to 5 people for indoor social gatherings, as well as telling people to close contacts of cases, whether they're vaccinated or not, to self-isolate for 10 days. Are you looking at that kind of restrictions now, kind of on top of what we're already doing?
Well, every option to manage COVID as appropriate remains available, and we'll continue to monitor, and the epidemiology team and the professional staff of the Public Health Service will make our best decisions to protect the community. I think that the province may also promulgate some advice on this issue, because as the holidays come forth, there will be people traveling from perhaps their college or university to their home. But yeah, I would anticipate that there may be additional restrictions, and that would be for the province to make those restrictions at some point in the future. But for Windsor-Essex, we leave every option available based on our local epidemiology related to what measures that we may or may not take.
Thank you.
Any questions from Radio Canada?
Yes, good morning. I think you've already addressed this question on Monday, but with the Omicron variant now in the community, I just want to make sure just want to know if there's any update. So I was wondering if Windsor is actually ruling out an early school closure before Christmas, or an extended school break in January for local school. So yeah, that.
Sure. So as a public health priority, keeping schools open for instruction is the number one priority from my estimation. Always every option remains available to manage COVID-19, but the Public Health Service will be reluctant to modify school schedules at a local level. I think we would continue with our efforts for containment. Schools have been disproportionately burdened with COVID-19. I think we're over 800 cohorts now of young people who've been dismissed from school. If I could put it another way, 800 cohorts of 20 children a cohort for 20 young people is 16,000 children. 16,000 children have been inconvenienced by COVID-19 exposures at schools. Most of those exposures are from penetration into schools from the community. So someone who is in the community who has COVID has been the chain of transmission within the schools, and the school pupils and young people are dismissed from school to help break the chain of transmission. So those 16,000 children, approximately 16,000 children, have done their part to control COVID-19. And remember, where is the chain of transmission? The chain of transmission is from child to parent, potentially to an older relative of that family, to a nursing home, or to a vulnerable person. And 2/3 of the people going to the hospital are unvaccinated. So those 16,000 children have done their part to try to control COVID-19 and to prevent or try to mitigate preventable and unnecessary deaths. Which goes to the question of that if you're eligible for the vaccine and you're currently not vaccinated, I urge you to go get vaccinated. You'll help you'll help the overall efforts for us to bring COVID-19 under control. There are 50,000 people in Windsor-Essex who are eligible for the vaccine and who have not been vaccinated. And really, of all the priorities right now is to get that community vaccinated. I would ask every person who knows someone is not vaccinated and eligible to ask them. If we can get the vaccination rates higher in the health district, we're likely to have better control of COVID-19 overall, and that will be one additional factor in keeping schools open for instruction. So once again, my apologies for that expansive response.
No, it's okay. And I don't know if you've already addressed this question, but there are more people asking for the third dose to be open to much and more people. So apparently the Ontario is also thinking of doing it. So what do you think? Do you think we should do that rather sooner than later?
Well, maybe I'll ask Nicole to comment on the operational aspects, but as a population health approach, knowing what we know about Omicron, I think it's wise to try to vaccinate as many people as possible. The higher the vaccine penetration rate for third doses, I think the more likely we are to have additional control of COVID-19. But even more importantly is to get vaccine into people who've not been vaccinated at all. Like as important as third doses are, which they are, it's even more important for those 50,000 people who are currently not vaccinated, who are eligible for the vaccine, to get vaccinated. Because remembering that 2/3 of the deaths are among people that are unvaccinated, and I think our latest number suggested, we can give you the email with the exact, but the unvaccinated constitute, I think, less than 20% of the health district, but they constitute 2/3 of the deaths in the district. Nicole, did I capture that correctly?
Yeah, I'll just add that, so again, I think we have said that 50 plus, have been eligible as of Monday. And what we do know is that it will open up to a larger population. It's anticipated in January as per the ministry announcements. And, just thinking about what we know about COVID-19 in general is, those individuals who are likely to suffer more severe outcomes. We know that age is a factor. So certainly our priority at the moment is for those that are unvaccinated, have not received a first or second dose, and then third doses for those who are in that most vulnerable age category, of 50 years of age and older. We have been increasing steadily our vaccination capacity in our mass vaccination clinic, as well working across our region and healthcare sector to really a call to action for everyone to put as much as they can into vaccination over the next few weeks. We are also looking into January, and will be certainly as a health unit, we're working on plans to further increase our capacity to meet the demand so that we can ensure that individuals are able to book and get their third dose in a timely manner when it's more broadly.
Okay, thank you.
We'll move into our follow-up round of questions. We will limit it to one question per outlet this morning, please. Any follow-up questions from the Kingsville Observer? Rob, I think you're on mute again. Rob, if you want to log out and then log back in, we will come back to you when you're back in the meeting room. So any follow-up questions from Windsor Star?
Yes, just wondering how long roughly does it take to receive the results for genome sequencing, when they are doing further lab testing to detect those variants?
There's a screening procedure which is more rapid, and then there's whole genome sequencing, which I think take weeks to get back. And Nicole, if you send us an email with that question, we can give you the more exact answer to that, because it's just not the process. It's not just the time to technically do it, but also the processing time at the laboratory. So we'll try to give you an exact answer on that. But there's a screening process, which is relatively quick. And then there's a whole genoming sequence, which is a bit more resource intense.
Sorry, I just asked to give the community some context, in that, of course, the Omicron case was confirmed yesterday, but can you comment on perhaps how long ago that individual may have been initially tested, because of the time it takes to do that testing?
Go ahead. We don't have, we can't speak to the exact timing, or at least I can't right now, the exact timing or that delay on the testing. But I think, again, we can commit to letting you know sort of the average time frame, the average time frame for when we do get those results back and we're able to report them. You will all be familiar, with Delta. This is similar, where we had an effect. It was a delay, and at some point, we know that just majority of our cases with Delta, and we expect the same to happen with Omicron. But we'll commit to asking our team what is sort of the average time frame that we do get results back related to variant.
Thank you.
Yeah, if I could supplement that, we've been working on the assumption that Omicron is coming since we knew about it. So the public health approach really was reflects the fact that Omicron wasn't anticipated, or there were going to be anticipated cases of Omicron in Windsor-Essex, and I expect that over these next few weeks that we'll see more and more cases of the Omicron variant. And I would hazard to say the Omicron variant is not the last variant that we'll see. And there'll be other variants as we move forward during the pandemic.
Thank you.
Any follow-up questions from our Kingsville Observer?
Yes. You mentioned, Doctor, on Monday that the Omicron variant was milder in terms of the symptoms. Is that how the viruses work as they mutate and new variants occur, that they are weaker in terms of the symptoms that people suffer? And the other question I would like to, and it's rather obvious, a vaccinated person as opposed to an unvaccinated person, in terms of the transmission of the disease, is it weaker amongst people that are vaccinated?
Yeah, so I think I said on Monday, and I think if I misspoke, we don't really know everything about Omicron's a new variant, and we have still a lot of understanding clinically about its burden of disease. What I can say is that most people with Omicron are likely to have mild to moderate symptoms if they're vaccinated. It's only and I think that's really what I wanted to convey.
Okay.
The general view is that Omicron is, if you have a case of Omicron, it's likely to infect more people than if you have previous variants. Now, exactly what the quantitative aspect of that is, I think that's still going to have to be worked out, but it's thought to be more infectious in that way. As a general construct, medicine's never perfect. It's never 100%. But as a general construct, people who have milder disease are less likely to transmit a respiratory infection to somebody else, because it's just not the virus or the particles of the virus that's within you, but how you project them. So if you have very severe disease and you have lots of symptoms and you're coughing and sneezing, you're more likely to give it to somebody than if you have mild disease and you're not having a lot of coughing and sneezing. So as a general construct, if you're vaccinated and you get COVID, you'll have a more mild disease, you'll have less symptoms, you'll have a shorter period of time when you're infectious, and you're less likely to give the disease to other people. That's the general view. Now, like everything, we have to wait and see if we have more information, but all the signals suggest that Omicron is more infectious than the Delta variant. And that's one of the reasons there's this heightened level of alertness throughout the medical community and the public health service.
And could I ask one more question? The investigation into the outbreak in Kingsville, what's the current status of that investigation, and when's it likely to be wrapped up?
And Nicole, maybe you could comment on that.
So outbreak, investigations are ongoing. Generally, they're rescinded, when we don't see any new cases associated with that outbreak for a certain period of time, like a 10-day, 14-day period of time. So we'll continue to monitor. It's always challenging, certainly in scenarios, as our team is always going back and looking at, ensuring and connecting cases to or removing cases from. So it's pretty complex, but generally speaking, when it ends is when we no longer have cases associated with that outbreak.
Now,
if I could supplement
Rob,
that, if I could
go
just
ahead,
supplement.
Doctor. Yeah, Doctor, and then we're going to move on to
all right,
please.
Thank
you. Go ahead, Dr. Ed.
So managing an outbreak is an individual level decision. It's almost like saying, when will an outbreak be over? It's like, when will my surgical case be over? When will I be out of the OR? Well, you're out of the operating theater when you're safe to get out of the operating theater. When you have an outbreak, the decision is about, now that you have an outbreak, when can that community of people affected by the outbreak, as broadly defined, go back to having the same risk as the background community? That's the decision you have to make. And you have to gather all your facts and make that decision. In an outbreak that involves 20, 30, 40, 50 people, there are likely 8 people who are contacts of every case. So you have to think of all the people that are affected by the outbreak, and many times outbreaks at restaurants affect other institutions like schools and recreational facilities. And it is an individual level decision, but based on the facts and circumstances, we'll try to conclude the outbreak when we think at the Public Health Service that the risk returns to the normal risk of the community. The second item is that sometimes outbreaks are concluded incrementally, so certain activities are relaxed and certain activities remain in force. And so that I hope that provides some additional context, Rob.
Thank you.
Thank you. Follow-up question from AM 800.
Nicole, just a quick one for you. I know Ramsey mentioned it a couple weeks ago during a summary that 50,000 people is a lot that's not vaccinated for an area our size in Windsor-Essex. And I know doctors mentioned it today, pushing that 50,000 to get vaccinated. I guess, Nicole, for you, and obviously you've been with the health unit for a number of years, just myself covering the board meetings, seeing you in your different roles. Does it surprise you that there's so much vaccine hesitancy in Windsor-Essex with, I guess, that 50,000 people?
Yeah, does it surprise me? Yeah, I think, that we continue, we've sort of, I think, hit a bit of a cliff or a wall, and still having such a large percentage of our population. Am I surprised we've not moved it a little more than we have? Yeah, I suppose I would say I am, and less maybe because I've been around a long time, as you say, or am part of this community, but just knowing the tremendous efforts and work and resources that are continuing to go out and have gone out, related to education and our sort of mobile outreach efforts into neighborhoods. And I know I've been asked multiple times what else can be done, and I think we are all struggling to sort of, figure out what strategies haven't we used and what additional strategies those who are still sort of hesitant or, or unvaccinated. So I don't know about surprise, but I think just given the amount, I think, of resources and effort and work that's being done to really reach into our community, I think, I would have expected what we would be higher than we are.
Thanks, Nicole.
Yeah, if I could share with you, there are districts that have vaccination rates above 90%. And in Windsor-Essex, for young children, vaccines that are covered by the Immunization for School Pupils Act, like polio, the vaccination rate, I think, is 92%. So the gap between what children have been vaccinated at a community level and COVID is surprising to me. On an individual level, I think everyone has to think of this. There are capacity limits on social gatherings. And every person who has a party or has a gathering, I urge them to follow the public health direction, which is 10. I also advise them that if they have people that are coming that are unvaccinated, to think what that could ultimately lead to. It could lead ultimately to hospitalizations and spread of disease. So I think we all have our role to play in this holiday season to try to contain COVID-19 so that we don't see many more cases after the holiday season is over.
Thank you.
Follow-up question from CTV.
Yes. What do you think of the new restrictions for long-term care homes that unvaccinated family members will not be permitted to enter? Given that this was the sector that was so hardly hit, are you surprised that this wasn't implemented earlier?
Well, I think that clearly elderly people have suffered disproportionately from COVID-19, and if there's an outbreak, the deaths have been disproportionately among the elderly up to this point. So I think any measures that can be promulgated to protect the health and safety of older residents, especially older residents living in nursing homes or long-term care facilities, is an appropriate response given where we are in the pandemic.
Okay, thank you.
Follow-up question from CBC.
Yes, I apologize if you have to repeat yourself here, but can you give me a sense of how many cases are being tested for the variants? Is it, how is that decided, or what's the amount of tests being sent to be tested for a variant like Delta or Omicron?
Well, every case is screened for Omicron, and every case is being screened right now. There's a type of the laboratory data items are sort of highly technical, but at this point, they're all being screened.
Thank you.
Follow-up question from Blackburn.
Yes, back on December 8th, the health unit reported that 42 people at Elite Restaurant had tested positive for COVID-19. Is there any indication how many people so far have tested positive as a result of that one incident?
I think Nicole can answer this question, but I think 45 people have now been recognized to have tested positive related to that outbreak. Is that correct, Nicole?
Yeah, last I checked, it was 45. But again, I think we did articulate it is complicated. Our team does a lot of work looking at additional cases and determining their link to the outbreak or ruling them out from the outbreak. But last update was 45.
Thank you.
And a follow-up question from Radio Canada.
No, thank you.
All right. Thank you very much, everybody. We will reconvene tomorrow morning, December the 16th. Have a wonderful day.
All right. Thank you. All the best.